Good afternoon and welcome to the Supporting Client Health and Wellness class presented by the Far Northern Regional Center's clinical team. My name is Nellie Camarena. I'm one of the RNs and I work for the Regional Center out of the Chico office. It's my pleasure to introduce the other members of the FNRC clinical team. Here on this call, we have Jen Badger, our nurse in the Reading office.
Hello, thank you for coming today. We're excited for today's class and really happy that you all came.
Thank you, Jen. It's so nice to have all of you here today, and I hope you find the information presented useful. As you know, if you've been attending any of our classes, we cover a variety of health-related topics that were identified by regional center providers, as well as health problems commonly faced by the individuals that we serve. For today's class, we're going to spend some time talking about fall prevention, and then some time at the end to talk about durable medical equipment. So here we go. So I wanted to start off with just some basic facts. Just because falls do tend to, be something that we do see in the population we serve. For many of our individuals, having a developmental disability, puts them at a greater risk for falling, which we'll talk about throughout the presentation today. And this can stem from a variety of reasons, right? It can be a gait imbalance issues, seizures, or many other conditions, which we'll address later on in the presentation. There was a report that was shared by the Association of University Centers on Disabilities that showed that about 50 to 60% of injuries reported in people with an intellectual disability were actually due to falls. And then injury-related visits to the emergency department and even hospital admissions in persons with a developmental disability, again, a lot of the times are primarily due to falls. So you can see that the population that we serve has a higher rate in sustaining these falls, and even moving forward to even having, fractures, increase in fractures in comparison to the general population. So as you can see, falls can be very serious. So what happens after a fall? There could be many falls where they just don't cause injuries or minor injuries, maybe some bruising, some achiness. But 1 out of 5 falls does cause a serious injury, such as a broken bone or even a head injury. These injuries can make it hard for a person to get around, do everyday activities, or even live on their own. And in more serious cases, when it comes to head injuries, this can be really serious, especially if the person is taking certain medicines like a blood thinner. So anytime we have an individual that we serve and that they've sustained a fall or they've hit their head, they really should be seeing their doctor right away to make sure that they don't have any other injury going on. The other thing, that we'll talk about later on is a lot of the times when people fall, even if they're not injured, they become afraid of falling. And this fear may make them, kind of cut down on some of their everyday activities, maybe make them less active, and over time can become weaker. Again, just only exacerbates the issue and increase your chances of falling in the future. So we're going to dig into some of the risk factors. But I thought this would be a good opportunity to ask you all, and again, you can unmute yourself or use a chat box. What can you think of some factors that may increase the risk of falls in the population that we serve? I know I mentioned seizures, gait imbalance, but what are some things that you've seen or experienced that could definitely increase the chances of someone falling and sustaining an injury? Yes, someone wrote rugs. We're going to talk about that, some environmental factors that can definitely increase the risk. Wet floors, absolutely. Some vertigo or unsteadiness and balance. That can make it tricky and definitely increase the chances. Weather, rain, snow. Yeah, if you walk outside and it's slippery and you're not, really paying attention, that can definitely increase that. Medications, we're going to talk about certain medications that can increase the chances. Thank you. Changes in medications, absolutely. So thank you. Yeah, there's a lot of, depth perception. Someone wrote down eye issues. We're going to touch a little bit on that too, especially as, we work with an older population. That can definitely be an issue. Walking too fast, someone wrote. Or if they're in a hurry and not really paying attention, can definitely increase the chances. Thank you. So let's kind of jump into that. We're going to talk about each of these categories here. Obviously the list can go on, but I just wanted to focus on some main points that might increase the chances of falls. We're going to start off with dehydration. So several months ago, we did a presentation on dehydration as one of the top 5 causes of death in people with intellectual and developmental disabilities. So during that presentation, it was really emphasized how dehydration is a huge risk factor for falls. And dehydration occurs, as you know, when you have insufficient body water and fluids needed to carry out normal activities. And it can occur when someone's either not taking enough fluids or they lose a lot of fluid, more fluid that they're taking in. And so as we age, the sense of thirst can also diminish. So even when your body needs to be replenished with water, some individuals may not even realize that they need to drink, right? And this can cause issues because if we're dehydrated, that can produce hypotension or low blood pressure, which can increase the risk of falls. And sometimes, this dehydration can occur without us even realizing it. With warm weather, that's a huge risk factor, right? Especially when we hit those, 90 degrees, triple digit numbers, that can really take a toll on our body. So that's why, especially with many of the clients that we serve, it's really important, especially if they're receiving supports from, caregivers, that we are keeping track and helping them and reminding them to drink water, especially if they're dependent on a caregiver for that. Because there's some individuals that may not be able to communicate that they're thirsty or just don't know. And so just keeping track of that is really important, especially as we get into warm weather. We're going to talk about medications later on, but, taking water pills or diuretics and certain other medications can contribute to dehydration and will make someone want to use the restroom more and have to urinate more frequently. So that can also increase the chances of not only dehydration, but again, risks of falls. So again, if you're a caregiver for pretty much anyone, even for children, right? That's especially true for young kids, making sure that they're not dehydrated, but especially for our older folks. And when we're talking about, risk of falls from dehydration, it's important to stay hydrated, set reminders, do whatever needs to happen so that we're constantly reminded to take in fluid. The other thing too is diabetes. It's also a huge risk factor, especially for someone who may not have, their blood sugars under control. I'm not going to dig in too much on this because I know we recently just did a presentation on diabetes, and you can hopefully log on to that YouTube video here soon. But one of the things we talk about with diabetes is it's a huge, even though dehydration is a concern for everyone, but it's especially concerning for someone who's diabetic. The combination of the dehydration and the diabetes can really lead to some serious complications because they go hand in hand. Diabetes occurs when the body doesn't produce enough insulin, so it creates there's extra sugar in the blood. So this actually causes the kidneys to work overtime to filter and absorb that excess sugar. So if the kidneys are overworked, the body then expels the excess sugar in the urine, which in turn drags the fluids from your tissues too, leading to dehydration. So that makes finding ways to not only, manage someone's diabetes and help them lower the blood sugar important, but it's, equally important to make sure that they're staying hydrated. Again, now that we're coming into the summertime and expecting a lot of heat and warm days. Okay, so we're going to scroll out of here and go on to our next topic, incontinence. So urinary incontinence means loss of bladder control, and it can vary from a slight loss of urine, after sneezing, coughing, or laughing, or complete inability to control urination. While it can happen to anyone, or urinary incontinence, we do tend to see it increase in some older folks, and it can contribute to accidental falls in several ways. I know someone talked about wet floors, right? That can increase risk. So if someone has incontinence episodes, that might accidentally, again, lead to a wet floor surface, and they can slip on that. The urge to urinate frequently on a daily basis may also tend to limit a person's physical activity, right? They might, have the fear of finding themselves, too far from a bathroom, or, maybe limit their outings just because they're afraid that they're not going to be near a restroom. And so again, we're going to talk about that later on when we discuss the importance of physical activity, but all of that has a potential to decrease their physical activity, right? The other thing, someone talked about rushing, walking too fast. If someone has urge incontinence, that can also increase the fall risk when they're, trying to hurry to the toilet, especially if they're like an unfamiliar or it's a cluttered area or at nighttime. All of that can increase the chances. Episodes of urinary incontinence sometimes could even be like transitory, like if it's related to an acute illness. So like a UTI that can cause incontinence, delirium, drowsiness, and even, low blood pressure. So that can be all interconnected. Medications. There's some people that have to take medications to treat incontinence, such as like anticholinergics or alpha blockers, which we'll talk a little bit more later on, but that can lead to postural hypotension, which we'll talk about later on when someone gets up too fast and they have a drop in blood pressure, can increase, the chances of falling. I touched on this a little bit when addressing someone who needs to urinate at night, but not only does that increase the chances of falling if they have to get up when it's dark, but if they're making frequent trips to the bathroom at night and it's poorly lit, it's obstructed, or maybe they're not getting a good enough sleep every day, all of that are huge increased risk factors. So there's a variety of things that can be done, right, to help prevent this. Some of it might just be some lifestyle modifications, avoiding extremes of like not drinking a ton of fluid, an extreme amount of fluid before they go to bed, maybe avoiding caffeinated beverages or alcohol, making sure someone empties their bladder before they use the rush or, before they go to bed. At nighttime, ensuring that the individual is wearing, appropriate clothes that can be easily removed, some good footwear to reduce slipping. Could even consider putting like a non-slip mat on the floor besides the bed for people who experience urinary incontinence from transferring from bed. We're going to talk about this later when we address like environmental factors, but installing handrails in stairways, in the shower, or next to the toilet might be helpful. Keeping the pathway from the bed to the toilet obstacle free, maybe leaving a nightlight on in the bedroom or bathroom might be helpful. And in some cases, it might be, assessing with the primary care doctor whether it's time to consider maybe using absorbent products such as, undergarments or underpads for some individuals. So those are just some ways that might be helpful when it comes to addressing urinary incontinence. Okay, so we're going to move on to the next one. So orthostatic hypotension. So orthostatic hypotension is an abnormal decrease in blood pressure. It's fairly common, and we do tend to see it a lot with older individuals. And symptoms can range from like visual disturbances and dizziness to syncope. Some individuals might experience from like standing, if they're laying down and then standing up really fast, can experience some lightheadedness, visual blurring, dizziness. Some might even have some like leg buckling or, gradual or even sudden loss of consciousness. So, we can see how that can definitely increase the chances of someone falling and getting injured. So some may not even experience this, or while others who fall may not even remember having had the symptoms immediately beforehand. So sometimes it can be missed if not part of a structured assessment. So some things to keep in mind when addressing this is we talked about it with dehydration, right? Dehydration can lead to some orthostatic hypotension. Reviewing medications, because there are medications that can also lead to this. Making sure clients aren't hurrying or when they're getting out of bed, or going to use a restroom at night, to swiftly, sit on the edge of the bed with their legs hanging down for a few minutes, before they stand up, instead of just gradually standing up really quick. That might help prevent that. The other thing too is perhaps even if there's individuals that like having very hot baths or showers or getting overheated, that can also increase the chances. So just maybe avoiding those situations or being really careful, if they're going to be in a situation that might cause some vasodilation and decrease blood pressure. Okay. Vision impairment. I know someone brought this up as a risk factor, so we'll talk a little bit about this. Vision impairment and blindness affects 1 in 11 Americans age 65 and older. Older adults who have impaired vision may be at risk for decreased, independence, poor well-being, and even, as again, increase the risk of falls. There's some statistics that say that in any given year, about like 30% of adults over the age of 65, will fall. So that's pretty significant. And so having an impaired vision more than doubles that risk. So, I mean, I think it's obvious to know that if anyone has a visual impairment, that's going to reduce their ability to detect hazards in the environment. And so again, that increases the chances. And then as we age, there is a decrease in our lens elasticity and pupil reactivity, which can lead to decrease in like dark adaptation. So our eyes adjusting to darker environments, and depth perception, as someone mentioned earlier. So again, all of this are huge risk factors. And again, going back to statistics, as a predominant number of falls occur due to slips, trips, and interaction with an environmental hazard, poor vision is usually the leading issue when evaluating falls risks. And what can we do? I think the biggest thing is ensuring that individuals have their eyes checked by an eye doctor at least once a year. These regular eye exams can help diagnose any type of visual impairment, such as a cataract, glaucoma, or a macular degeneration. And it's also really important to have these regular exams because that's an opportunity to update eyeglasses if needed. Some people might even recommend, if there's anyone with bifocal or progressive lenses, for some, it might be a good idea to get a pair of glasses with only their distance prescription for outdoor activities, such as walking, just because sometimes the bifocal lenses can make things seem closer or sometimes even further away than they really are. So kind of separating that. So that's another thing to consider. Okay. Now we talked about weakness and gait imbalance is another increase of risk. So I think we all know that falls can cause injuries that will make it hard to live as independently as possible. And one of the things that happens too is, especially if someone's had a history of falls, they develop that fear of falling again. And will make them, maybe be less active or may not want to go out as much, just because they're afraid of falling. And it only hinders the situation, because if they're not active, it's only going to increase the chances of falling. The other thing too is, as our individuals get older, there's a decrease in bone density, and that's a huge issue, especially with a vitamin D deficiency. When someone has a vitamin D deficiency, they have inadequate amounts of vitamin D in their body, which can cause health problems, like, again, that can lead to muscle weakness. So ensuring that gets checked, when they're going in for regular checkups with their doctors, always making sure that their vitamin D levels getting checked. And if they do have a deficiency, maybe they need to start taking supplements for it. And again, just the importance of any physical activity. Strength training is always going to be helpful. Any type of exercise program, if it's available. Just because it has been shown that with some type of physical activity that is safe for them can actually be really beneficial overall. Okay. We're going to jump into seizures as another risk factor. Okay, with seizures, especially if someone is having, with experiencing with generalized onset seizures, particularly tonic-clonic, atonic, or myoclonic seizures. These are the types of seizures that can increase the risk of someone sustaining, injuries. So it's really important that we're providing services and we're caring for individuals that have epilepsy or a seizure disorder, that they really are followed by a doctor on a regular basis, so that they're taking their medications that's prescribed. Because, as we know, if someone has uncontrolled seizures, that can definitely lead to an increase of serious injuries if they fall and hit themselves. Falls are a common cause of injury and fractures among patients with epilepsy, and actually can contribute a lot of the times to the higher rate of hospitalizations in patients with epilepsy in the general population. And then the other thing too is that although some falls may be attributed to epileptic seizures, a lot of the times, which we'll talk about later on with medications, it could also be a result of someone taking their anti-epileptic drugs, especially if it's fairly new for them. So just making sure that if it's a new medication for someone, that they're taking it easy and following all the preventive measures that we've been addressing today. Just because there are some medications that can lead to side effects like the drowsiness or dizziness or imbalance that can increase the risk. I'm going to jump on to the next one. So speaking of medications, so I know someone mentioned this in the beginning, that there are actually many drugs that can increase the risk of falls. The more drugs that you take, the greater the chance that one or even a combination of them will make a fall more likely to happen. Some medications are well known for side effects that can increase the risk, right? So for example, many times you might have someone taking an antihypertensive medication to keep their blood pressure under control and to decrease the risk of stroke and heart failure. However, these drugs can cause blood pressure to get too low sometimes, or might experience that orthostatic hypotension that we mentioned earlier, especially when they're, stand up from a lying or sitting position. So again, the result is someone feeling lightheadedness, feeling faint, which can lead to a fall. There are medications that suppress the central nervous system, are among the most likely to contribute to falling, as they reduce alertness and cause slower reaction movements. So there might be, some medications like Valium or Ativan, Benadryl, an older antihistamine, because it causes drowsiness. That can increase the chances of falls. And the thing to keep in mind is a lot of the over-the-counter sleep aids or medications like NyQuil, or pain medications, especially like Tylenol PM, Motrin PM, Aleve PM, all of those sometimes may have Benadryl as an ingredient. So just keep that in mind if we ever have clients taking those, that's to keep in mind, could be another potential risk. We talked about some medications with individuals who experience urinary incontinence. That can also increase to falls. Some antidepressants or medications that are used to relieve like chronic pain or nerve pain are risk factors. We talked about sleep aids, but prescription sleep drugs like Ambien, Sonata, or Lunesta, all of those have, those risk factors. Medications like opioids, Vicodin, Percocet, Dilaudid, fentanyl, all of those, if someone's taking that because maybe they just had surgery for something and need to take that for short term, just keep that in mind when working with them, that they're taking it cautiously and doing anything to minimize them feeling lightheadedness. So I know we've talked about this in other presentations, but really this just emphasizes the importance of, when we're working with our clients, recommending that they always have a list of all their prescription and non-prescription medications and supplements, so that they're bringing that to the doctor's appointments, especially if they're being followed by different specialties. That way it's all consolidated and the doctor can look at it and make sure that they're assessing for any, side effects or interactions that can increase the risk of falling. To help with, fall prevention, then the healthcare provider may even have to, consider taking someone off of certain medications if they think that it's affecting their thinking, or if it's making them really drowsy or sleepy. So making sure that we support our clients in that aspect. Okay. So environmental factors, we touched on this a little bit. There's a lot of things in the home environment that can increase the chances. I know someone talked about rugs, having clutter all over the home or the floor conditionings, making sure that there's no loose wooden floorboards or carpeting. Dim lighting can also be a big risk factor, right? Making sure that we have good lighting and adequate lighting for the clients. Having them wear proper shoes, or in proper furniture design or the layout of the home. Toilet and bathtub design, inappropriate use of equipment, or even slippery floors. I think this is a good time to bring open the chat box again. What are some safety tips that you have seen or would recommend that when working with clients, especially in the home environment or even at day program? What are some things that you and your staff have done to help increase the safetyness? Yes, someone wrote grab bars. That's really helpful, especially we mentioned earlier, making sure, or even handrails too, right? In the bathroom, when you're in the bathtub, is all really helpful. Ensuring pathways are clear of obstructions, absolutely. Someone wrote night lights. Wet floor signs are really important for cleaning after something and making sure that someone may not know that it was just mopped, making sure that there's signs up so that they know to be careful. A shower seat, yes. cords neatly. Yeah. If they're in an area where there's cords kind of hanging out, making sure that it's all, fixed neatly so it's not in the way or increase the chances of someone tripping over it. Yeah, someone wrote clear walking area into out of house, the patio. Yeah, making sure when we're not leaving stuff outside in the front door. The other thing too, speaking of that, if anyone has small animals, sometimes, especially if they're little dogs or whatnot, who are really excited to see people might be jumping, and that can also increase it, right? If they actually get in the pathway and in the way of walking. Proper footwear is really important. Shoes under bed. Yeah, having shoes ready, especially for those who need to get up in the middle of the night. Outside stairs marked with safety strips from Home Depot. Yeah, that's a good idea. At dining table, spilled food under table. Making sure we're vigilant when they're eating, whether it's at home, at program, or even out in the restaurant, making sure that if anything gets spilled, that it gets cleaned up right after so that they're not accidentally slipping on that. Yeah, wet floor signs. Yeah, those are all really good ideas. So I think you talked about most of these on here. Getting rid of things one could trip over. So secure cords. I know someone mentioned that from walking areas, and using non-skid rugs. Grab bars inside and outside the tub or shower and next to the toilet. We talked about railings, especially if they're stairs. Lighting, make sure that the home has good lighting. Keep items that are used often in cabinets one can reach easily without having to use a step stool. That's important, making sure that they're not, and this is for us, for anyone really, making sure it's accessible. And then non-slip mats in the bathtub and on shower floors. And I'm sure there's a lot more out there, just that I'd sure feel more common ones. Okay. So now that we've talked about various risk factors, that we would spend some time talking about equipment that might be beneficial for individuals to increase their safety and decrease the chances of injuries or falls. So we know that there's several medical, physical, and even mental benefits associated with the use of equipment. For example, there's some DME that allows individuals to become more independent, and it decreases the level of assistance needed from caregivers. With the potential for increased independence, there's a greater capacity to enhance their overall well-being and social engagement, right? So with equipment, it's really intended to increase their independence, increase their safety, and assist with transfers, ambulation, or mobility. So equally important to assessing their equipment needs includes considerations for their home environment, right, to help prevent falls in the home. So environmental barriers, everything we just talked about to safety and function should be addressed for essentially every client that we support. It's especially important if we're providing to any assistance to a client that had a recent change in condition, or has been currently hospitalized, or is in a skilled nursing facility for short-term rehab. I thought we could spend a few minutes talking about that, because a lot of times we end up clients in these situations because they sustained a fall, right? They fell at home, maybe they fractured something, had to be hospitalized, may need short-term rehab to help with some of their physical activity. So this is where many of the providers, especially if you're a provider who provides either SLS supports or in a group home, discharge planning is really important to ensure that the client has everything that they need, especially for those that are in the hospital or in a skilled nursing facility, so that they're ready to go home. So if you are a provider and you're supporting a client who will be discharged from the hospital or a short-term rehab, and are not sure about how they can be better supported at home, it's really important that you meet with the team to assess the needs with supports, looking at their bathing, how they're dressing, the restroom, or even ongoing therapy needs once they go home. So making sure to get all the needed equipment and supplies prior to the client even leaving the facility or the hospital. So it's really important to find out what if someone's in a SNF, what they're going to be able to provide or order, or if they're going to order home health, who's going to provide what or assist with getting the equipment for them. So, some really good questions to consider or ask when you're meeting with the discharge team. So if it's in a hospital, the hospital has case managers that are assisting, with the discharge. If it's someone in a skilled nursing or a rehab, they also have social workers there that assist with the discharge process. So if you're ever in a situation like this, especially if you're a provider that doesn't have to do this too frequently, it's really important to have all these questions ready. And especially if they're going to require like a wheelchair or a walker or any equipment or even grab bars, knowing who's going to order them, who's going to help, if it's something that needs to be installed or something that needs to be done in the home, understanding who's going to do it, who's going to teach the caregiver to use the equipment properly. Asking as part of the discharge planning, does the client need any type of like a shower chair, commode, equipment, or even like a hospital bed? If so, figuring out who's responsible for ordering it. Again, if it's prior to being discharged, that's something that the providers at the hospital or the rehab facility can help coordinate. In addition, the team, whether it's in the hospital or a SNF, can assist in ordering home health. And that's really important because especially if it's someone who needs additional therapy sessions, or maybe they might need new equipment, and this is totally new to the client or really, really new to the care provider, they can have a therapist come out and do a home assessment and recommend equipment and provide training for staff. So everyone is, feels comfortable and ready to support that client when they go home. If the hospital or the SNF is gonna order equipment or supplies, or if they're gonna be ordering even like home health, it's really important to take down like the names and contact information of the equipment or supply company, the home health agency, if that's being ordered. That way, who to contact if a problem does develop when the client goes home. A lot of the times, we think that, everything's being ordered and, they get home and there's some things that are missing or something's fell through the cracks. So knowing who to call before they even go home is really, really important. I'm looking at the chat box. Yes, thank you, Jen. She just wanted to emphasize that sometimes the skilled nursing facility can have a PT home evaluation where they come to the house and assess what is needed before, before the client goes home. So all of those are just important questions to ask and be prepared, so that when it does come time to the client needing to go home, everyone is ready and everyone is trained and everything that you need is in the home. So that's kind of just a really, really fast and brief overview of ways we can support clients when they're being discharged from, skilled nursing or hospitalization. But I know a lot of the times we also provide supports to clients who either live independently or they live with families, or even if they live in the group home, but maybe we're starting to notice that they might benefit from certain equipment. And you're not really sure where to start with that. Really, the first thing and the best place to start is to discuss this with the primary care doctor. The primary care doctor can, perform the assessment. They're going to be the ones ordering the equipment. And a lot of the times, again, going back to the therapy, sometimes it's even best to recommend having them order home health for a PT or OT evaluation, where they can come out to the home and do that home evaluation. And then they can recommend specific equipment based on the individual's needs and the home environment. That way the therapists collaborate with the family, the caregivers, and the doctor to really clarify, what client factors are present in order to make like individualized equipment recommendations for depending, on the activity or the need. And so to get therapy involved, the doctor can, again, order the home health and have the therapist come out and do the evaluation. That way everyone's kind of working together and looking at it from different angles to make sure the most appropriate equipment is ordered. Another really important, beneficial reason for getting therapy involved is that sometimes, providers may not know the rules for the insurance company. And that's oftentimes why we see equipment denied, right? At least, the therapist will know what needs to be documented or how to document it, and can also really work closely with the medical supply company, who will also know like insurance regulations or any special forms that need to be filled out to help someone qualify. So that's why it's important to get, the whole team involved. Any point if someone's needing like a wheelchair or something like that, to make sure that it's really assessed and the proper documentation is submitted. Okay. I'm going to jump into just a really brief overview on kind of insurance. So again, important to work with the providers. That way they know which, and it's also important for the providers when you're working with them, because a lot of times they'll at least have an idea of what equipment isn't covered or what is, or how long the equipment is covered for, and when it's, when it's eligible to be replaced. And a lot of the times the medical equipment company can help kind of answer those questions. So like, for example, like with wheelchairs, a lot of times they're are typically covered every 5 years. And then we have like orthotics or ankle foot or orthoses that are covered like every 2 years. So kind of providers will have an idea of some of those rules. If not, they, knowing where to look it up. And the other thing too, to keep in mind, especially if it's a client that has like a more of a progressive disease, working with the team on understanding the limits for replacing items, and then not only considering what their current needs are, but also what their future needs will be to ensure that the appropriate equipment is available for those individuals. So like I'm talking about individuals that might have like multiple sclerosis or muscular dystrophy, like any condition that we know can progress down the road. So keeping that in mind as well. Okay. So we talked about, documentation in these situations is really important. And so, again, working on this early and getting everyone involved will only increase the chances of everything going through and moving smoothly through insurance. The other thing to keep in mind is that for many equipment prescriptions, a face-to-face visit is required. So this means that equipment can be prescribed to a client only after like a doctor, physician assistant, nurse practitioner has physically seen them. Telehealth is usually permitted with this too, but really insurance wants to see that this encounter happened and that the primary reason that the client needs that equipment is documented. So again, back to the example of someone who's needing a wheelchair, then that face-to-face visit should address like their mobility issues and have all of that properly documented. And the other thing too, that what insurance are looking at typically for these situations is that face-to-face visit or that encounter must have occurred within 6 months of the date of the prescription. So if someone ordered something and it never got to the equipment company and it just kind of stayed stagnant, then there might be a possibility, especially if it's been over 6 months, hopefully that hasn't happened, but we have seen that, they might need to see the doctor again and get it ordered. So just, different things to consider. And then the other thing too is, if you're working with a client and the insurance plan doesn't approve the equipment, like we don't give up then. A lot of the times, if you ever come into that situation, please reach out to the service coordinator. You can reach out to Jen or I to look into that. Because a lot of the times it could just be that, maybe additional documentation was needed from the provider, or it could be, a really simple fix. And so addressing that promptly is going to be, your biggest bet in getting something covered. The other thing to keep in mind, like if insurance doesn't approve that piece of equipment, they'll issue what's called a notice of action letter that tells you and the supplier or the equipment company why the service has been, delayed, modified, or even denied. And then it should tell you at that point what can be done to have the decision reconsidered. So like appealing the decision. So even though this seems like really complicated and cumbersome, there are sometimes ways to make this, be successful. And so where we see sometimes this not go through is that a lot of, we might have clients or families that kind of give up initially, because again, it can be really, complicated and frustrating, but there are ways to appeal it. And again, if you talk to us or the service coordinator, hopefully, we're involved sooner. We can help kind of facilitate that. But I think really the biggest message is the persistence and patience and understanding the process and knowing what resources are available to have a, successful outcome with that. And I'm going back to the chat box because I think someone wrote, it's especially hard to get items for the DEPs because insurance many times won't do doable orders on many items, and some items are too big and cumbersome to transfer back and forth. Yeah, and we see that, it can be really frustrating for caregivers of the families. I think, again, the biggest thing is ensuring that if you're running into those issues, bringing it up, being persistent. A lot of the times it could just be, something's fall through the cracks, unfortunately. And so it's really our job to kind of stay on top of it and follow up with the provider, follow up with the equipment company, again, reaching out to the regional center and seeing if we can help, advocate on your behalf in some way. Yeah. Okay. Yeah. Sorry, Renee. Day programs. That's what I figured you were saying. Yeah. That is a really good point. Sometimes equipment, especially the bigger pieces of equipment, insurance won't cover 2 of those. And it does make it a little bit complicated. The other thing I was going to mention too is that if we ever run into issues, the health plans have a case management team, whether it's partnership or Anthem Blue Cross or California Health and Wellness. If we're talking about Medi-Cal, it's always good, we could always get the case management team involved because then they can help kind of walk us through what is it that's missing, what is it that's needed for certain pieces of equipment to be authorized. So there could be different ways. I know it sounds, again, complicated and cumbersome, but I think the biggest thing is just communicating and following up on any of those issues. So with that, I was gonna, again, open it up to you all if you have any comments or questions or experiences that have either helped you in the past, or, talking about falls prevention or even equipment, anything that you would like to share with the rest of the group that you might find beneficial.
Hey, Nellie, I'll go ahead and chime in just for a second.
Okay.
I was just going to say that, a lot of our folks have some pretty significant mobility issues and need help with things like not just ambulating, but maybe just transferring. And it's really important, for staff to be trained on proper technique for transferring, so that, not only can the client be safe, but also so that the staff doesn't fall or get injured as well.
Yes, thank you, Jen. That's a really good point. And that can, especially when we're talking about, whether it's a client at home and talking to the provider, or maybe, again, going back to the example of someone who's experienced, acute change in their condition and they're maybe in the hospital or skilled nursing facility, there are equipment. So like Hoyer lifts, for example, that can assist with transfers and can help, caregivers so that they're safely helping the client transfer, and that their safety is also addressed so that they're not getting hurt or injured. So all of that's really important to bring up and talk to the providers, because there are ways to support staff so that they feel safe and the client is safe as well. Yes, proper body mechanics.
Yeah, Catherine, I see your comment too about PT can help with that. And also, Tiffany, you asked if anybody does a class for that. Usually the best way to get that kind of training is hands-on. So like if an individual goes to a rehab facility for a little bit, you can have staff actually go to the facility, and PT will oftentimes assist or train staff right then and there how to safely transfer, especially if it's a change for the staff or the client, is now needing more help than they had in the past. But sometimes they will provide that training kind of on site, or home health physical therapists. They do a lot of that kind of training when they come out to the home. So like if you have home health coming out to see someone to do physical therapy, you can arrange that ahead of time and be like, hey, I want all my staff to be there when you show up, so that you can show them how to safely transfer this client. And that's one way to do it. Otherwise, the only time I've ever seen those classes taught is generally like for nursing, or like, if you work at a hospital or something, they'll have trainings and things on that. You might be able to find some good transferring education on YouTube. There's probably some good videos on there that are done by physical therapists with different ways of safely transferring people. And, Nellie mentioned using a Hoyer lift. And I think, a Hoyer lift can be dangerous if it's not used correctly. You know, you don't want someone to fall out of it, right? And so I think it's important to have you know, your staff be trained on the Hoyer lift when it comes. And sometimes the equipment company can do a short training with staff when they bring it to the house on how to use it. But you know, just being able to make sure everybody knows how to use the equipment correctly is going to really help keep everybody safe.
Yes, thank you, Jen. Well, with that, if there's no other questions, again, we'd like to thank you all for taking the time to join us today and provide some good input and insight. And hopefully we'll see you again next month. Thank you.
Thanks, Nellie.
Thank you, Jen.